Summer na summer talaga guys because even if I'm not doing anything, kahit di ako masyadong gumagalaw, pinagpapawisan ako. And in relation to the increased heat and humidity, marami nagtatanong sa akin about excessive sweating and body odor. So for this video, ang pag-uusapan natin is body odor, also known as BO, what causes it, and what we can do to get rid of it. Para sa mga first-timers in my channel, I am Dr. Gaile Robredo-Vitas, your board-certified dermatologist. I post at least one video a week on anything and everything about the skin, hair, and nails, and I'm also on Instagram and Facebook posting similar content about the skin. Body odor or BO is not really a cause for concern. Hindi siya nakakahawa, hindi naman siya delikado. In fact, in animals, it plays an important role in their defense, in their survival, and even in choosing their partners or mates. But in humans, lalong-lalo na sa ating mga Pinoy, having BO is generally considered undesirable and can impact an individual psychologically, physically, emotionally, and even socially. Some who have it may avoid or minimize interacting with people, while others can experience anxiety, low self-esteem, and even poor quality of life. Pero bago natin pag-usapan kung paano natin magagawa ng paraan ng pagkakaroon ng BO, let me first discuss why it happens and what causes it. Our body, buong katawan natin, is covered in sweat glands and they perform an essential function called thermoregulation. Pag umiinit or tumataas yung temperatura ng katawan natin, our sweat glands open up releasing water, which evaporates, cooling our body down. So, this is important lalong-lalo na ngayon na sobrang init. Now, there are two kinds of sweat glands that can be found in distinct areas of the body. First would be the eccrine glands, which are distributed almost all over and produce majority of our sweat containing mostly water and electrolytes. Now, apart from thermoregulation, our eccrine glands are partly responsible in our body's waste excretion. And then we have yung tinatawag na apocrine glands, which are found in areas like the underarms, the groin, and the genital region. They secrete less sweat than eccrine glands, and nagigilang silang active after puberty. Now, apocrine sweat is more viscous, mas makapal ng konti compared to your eccrine sweat. They are also protein-rich and are initially odorless. However, once they mix with microorganisms found in your skin, they can produce odor. The medical term for BO, or yung ginagamit namin in our clinics when we write our diagnosis, is bromhidrosis. Tinatawag siyang eccrine bromhidrosis kung yung mismong pawis ng isang individual is the one that smells or gives off an odor. So there are several factors that might be causing it. First would be ingestion or eating certain types of food like your onions, garlic, and using spices like curry. Second would be in relation to certain conditions. For example, if you have kidney diseases, sabi nila your sweat can smell like bleach, or if you have diabetes, your sweat can have a fruity smell. And third, it can be secondary to metabolic disorders like yung trimethylaminiuria, which supposedly gives you a fishy odor kahit ilang beses kang maligo sa isang araw. Another one would be hypermethionemia, which gives off a sweat that smells like boiled cabbage. Another example is when we age. A particle called 2-nonanol is said to be responsible for giving the elderly that kind of smell. Para naman dun sa mga may apocrine bromhidrosis o yung BO coming from your axilla or your groin, simple lang yung equation dyan. Excessive sweating plus bacteria that decomposes the components of the sweat equals body odor. In the underarms, for example, pag pinagpawisan ka, your bacteria on the skin will start to decompose and degrade the sweat into molecules that give out certain odor. Now, depending on the type of bacteria present, iba-iba yung nagiging byproducts and iba-iba yung nagiging smell. For example, ammonia, which gives a urine-like smell or yung tinatawag natin in Tagalog na mapanghe. Another one is your E3M2H short fatty acid, which is said to give a very strong pungent odor. Yung parang malakas na medyo masakit sa ilong. Third would be your HMHA, which is said to give off a rancid, cheesy smell. Yung parang maasim or fermented, or how it smells when someone takes off his socks. And number 4 would be your MSH, which is said to smell like onions or clary sage o yung amoy sibuyas. Now, apart from these, there are also indirect causes. For example, yung mga hormonal imbalances that trigger your body to produce more sweat, or sometimes when you have stressful situations, kinakabahan ka, pinagpapawisan ka. So, all of those can indirectly contribute to having your bromhidrosis. So, ngayon na alam na natin kung ano yung mga pwedeng dahilan kung bakit nagkakaroon ng BO, pag-usapan naman natin kung ano yung mga pwedeng gawin para makontrol or matanggal ito. The only way that a satisfactory outcome can be achieved is to identify what is causing you to have BO and to treat it or get rid of it. And this is why it's very important to know the possible causes of why people have body odor. Because for example, if it's due to an underlying condition, when you treat it or address it, pwedeng mawala na rin yung BO. And now to address what I think is the most common body odor, underarm BO. Pwede rin itong gamitin dun sa mga may groin or feet BO. What you have to do are two things. First is to address excessive sweating, and you can do this by applying antiperspirants like your aluminum chloride, which work by temporarily blocking yung mga sweat glands mo para hindi ka pinagpapawisan. Or you can also use deodorants, which supposedly mask the odor, and since most of them contain alcohol, they also sort of reduce or minimize the number of bacteria present in the skin. And then number 2 is by reducing bacterial counts through proper hygiene, such as taking a bath at bedtime, paying close attention to your T-wags or your toe webs, axilla, and groin, and or using topical antibacterial agents in the form of washes like your benzoyl peroxide wash or antibacterial soaps. And sometimes when it is warranted, we may give topical antibacterial creams. For severe cases that are kind of hard to control, in our clinics, in a dermatologist's clinics, marami kaming treatments na in-offer. One would be botulinum toxin A injections, which address the sweating component of this problem. However, this is temporary and will have to be repeated every 4 to 6 months. Another one is using energy-based devices like your microfocus ultrasound, your high-energy microwave, or even radio frequency, which selectively target the sweat glands, permanently destroying them so that you don't secrete sweat anymore, or at least it's minimized. And then third is surgery, which some of us do. It's called your axillary suction curettage, which permanently removes the sweat glands from your underarms through suctioning or removing where they are contained. Ngayon, meron din other helpful non-evidence-based tips that I sometimes recommend to my patients depending on yung lifestyle nila and yung situation that they are in. One would be minimizing the intake of yung mga food na na-mention ko kanina na pwedeng makakontribute to a smelly sweat. And then of course, stress reduction, because as we all know, when you are stressed, it can influence your hormones and can stimulate more sweat production. Third would be wearing loose-fitting, breathable clothing like those made of linen, mga cotton fabric, and dun sa mga mahilig mag-workout, yung mga moisture-wicking blends. Another one would be having regular bowel movement and urination, because it is said that when you do them regularly, nakakatulong siya na tanggalin yung mga undesirable metabolites na pwedeng makadagdag dun sa pag-amoy or pangangamoy ng pawis natin. And of course, if all else fails, if wala na talaga sinubukan mo na lahat, I recommend that you go to an expert like a board-certified dermatologist to have yourself assessed and to have a personalized and more targeted approach to treatment. So this ends my short video on body odor or BO. Hopefully, I was able to answer your questions about body odor, and sana nakatulong yung mga suggestions ko on how to deal with them and possibly get rid of them. For any questions, comments, or if you want to share your experience, don't hesitate to put them in the comment section below. If you want to know more about the skin, hair, and nails, and dermatology in general, please don't forget to click the like and subscribe. I'll see you again soon. Bye!